G'day, Matt Maniacs. Andrew here. Another Monday night Matt Musings, as I'm coining it. Wanted to come and have a chat to you. We had an awesome weekend over the weekend, actually up in Sydney. Stephen and myself were up there. We were working with a bunch of health and fitness professionals, particularly with some of our other technology, getting some individuals on board with the Accent system. But as always, like what we get to experience with Matt, it's always a great opportunity to speak to other people, see what they're doing, what other people are involved in, and I guess have some awesome discussions, as what always happens at these type of events, and to kind of really pick the bones out of a few different topics. And I wanted to drop in with a couple of my favourites over the weekend that we covered off. And the first one was the future of health and fitness and where we kind of see things going. And I guess that's one of the things that we get asked all the time. I mean, we're kind of involved very heavily with being able to, I guess, try and bring some of the latest evidence, some of the latest testing, the latest assessment to the health and fitness world. And we're very, very passionate, obviously, about making that really accessible and making that really easy to do so that people can get the most out of working with their patients or with their clients. But I guess there are just other things that influence that as well. I think one of the biggest issues that we have as health and fitness professionals is there is a lot of confusion around what we all do and who should your average client or your average patient see, depending on the issue, right? And this is really, really problematic. I think one of the big issues there. G'day, Neil. Just jumped on. How are you going, mate? I think one of the biggest issues with that is obviously very, very confusing, because if I'm an individual who has back pain, let's think about all the different professions that I might go and see. I might go and see a physio. I might go and see an osteo. I might go and see a chiro. I might go and see a myotherapist. I might go and see a Chinese medicine practitioner. I could see a whole heap of different medical professionals, health and fitness professionals about that back pain, which might result in lots of different things. So I think there lies a lot of confusion for a lot of individuals. And I think realistically, the future for us is to try and simplify some of these things. So it's probably not a popular opinion, but I think at some stage, we're all going to have to come together in some way and unify in some respect to be able to, I guess, try and minimize that confusion and try and establish maybe some better standards for how we're doing things. Already we see a lot of different professions kind of borrowing traditional philosophies and techniques and ways in which people have done things for a long period of time from one another. For example, you know, myself as an osteopath, I use a lot of exercise-based care and a lot of exercise-based therapy, which might be considered maybe more in the physical therapy or the physiotherapy realm. And also we're saying, you know, a lot of physiotherapists potentially be hands-on at times, which maybe might not have been the way in which they go about things. I think the thing is, though, that we're discovering is obviously the techniques aren't that important, and we're all starting to apply maybe a more evidence-based approach, hopefully, in trying to use what is actually kind of founded in good research and good understanding and working with the individual that's in front of us. So a lot of confusion around that. So that's the first point I see for the future, obviously. The other thing that was a big topic of conversation when we were talking about this is the, I guess, the emergence of a results-based healthcare system, right? So one in which no longer will maybe the remuneration of physical therapy, of healthcare, of looking after people's fitness and wellness be based around how many sessions you see them for. It's actually going to be around the timely manner in which you can get a positive outcome with those individuals. And we're already starting to see this occur in the United States, for example. So already a lot of those health insurers, a lot of those third-party payers are paying out based on the results of those healthcare, I guess, outcomes with the patients and the clients that they're working with. Now, of course, to be able to establish that, then what we're going to need is good metrics and good understanding of what we're doing and how we're working with people to actually get great results. And this is where then I think if you're not already on board with utilizing a more data-driven approach to how you're looking after people and how you're managing them, then you need to get on board, because that's going to be where the future lies, right? It doesn't matter so much about what techniques you're doing as much as how you're actually able to measure the effectiveness of what it is that you're doing. And that's obviously a thing that we're, probably a bit biased at here at MAT, and certainly something that we're very, very passionate about creating, but being able to understand that results-based healthcare. So certainly I see that being the future, because there's just no way that, health insurers can continue to, I guess, be paying out, the premiums that they're paying and with the things that are going on, and still make money as a business, right? We're already seeing that all the time in terms of our own, kind of the expense for private healthcare and the money that we have to pay out as consumers for healthcare, that these things are just rising and rising and rising, because at the end of the day, all of these things are businesses. And so as a business, we can't keep affording to be able to, just pay out on some of these services that are being delivered if the results aren't coming through. It's becoming a real problem. So there's some key points where I guess the future of healthcare, I think, for certainly in our opinion, that's where some of those things are going. The other interesting topic that really came through, and I really enjoyed this discussion as well, was talking about, do we actually need a diagnosis to be able to help someone? Right? Do we need, when we're performing our assessment, do we actually need to establish whether or not there's a tissue-causing symptom before we can engage in some type of treatment or management plan? Now, for me personally, I think actually it's not that important when we take, once again, a more data-driven approach to how we're looking at working with the people that we work with. So for us, our philosophy is often about trying to establish, okay, where is this individual right now? Where is it that they need to be? And how are we going to construct a plan to get them there, right? Now, does that mean that I need to know whether or not there is, necessarily a tissue-causing symptom that's involved in that? Potentially not in many cases. Sometimes it will influence, I guess, maybe some of my choice of my the techniques and the exercises that I might use as part of my management plan, but often it's not the essential component of all of that, because what is essential is trying to understand, where does this individual kind of lack in their capacity for movement and what it is that they do. So potentially they lack flexibility in some ways, they might lack strength in some ways, they might lack balance, proprioception in some ways, they might lack power or endurance or efficiency of movement in some ways, right? I need to have ways to be able to measure this. If I can measure this, then I can control it and I can manage it with the people that I work with, and I can help them enhance their physical well-being to try and improve where it is that they want to be and where it is that they want to be able to get to. At no point in that whole process do I need to establish, is this a gluteal tendinopathy? Is this a facet sprain? Is this, some other type of pathology in many ways? So it's not necessarily about the diagnosis. And I think the problem with the diagnosis in some ways can mean that we get very fixated on one particular area, as opposed to looking at the individual as a whole. Because at the end of the day, we're all organisms. We're all designed to cope with stress. We've got inbuilt checks and balances and redundancies to help us, I guess, compensate for when things aren't necessarily working perfectly. And that's what it's all about, being a human being. So an interesting way in which we can potentially start to go about it. And certainly since we've adopted this philosophy here at MAT, it's been revolutionary in terms of the way in which we've been able to do things. And I certainly believe has been able to help us get better results with the people that we work with. So just a couple of points from the weekend. As I said, always awesome. And one of my favorite things about what we do is the fact that we get to touch base with lots of other health and fitness professionals, not only around Australia, but also around the world. Have been having a lot of fun in the discussion with some of the guys on the MAT Online Level 1 course over the last few weeks. It's been great to really get some great discussion and input from those guys too around some of these topics, because that's the thing, right? We all need to come together and all need to help each other, because at the end of the day, we're all here to try and help people feel better, move better, and perform better. So that's that it from me on a Monday night, Monday evening. Hope you're going to have an awesome rest of your week. Stay safe, and we'll touch base soon.